This is Dr. Radio. Coming up next, from the heart of the NYU Langone Medical Center, everyday issues that impact your health and well-being. This is Primary Care Medicine.
All right, well, welcome you guys. I'm Dr. Marina Kurian, clinical professor of surgery at NYU Langone Health and NYU Grossman School of Medicine. My super awesome co-host is here, Rachel Lustgarten, who is a clinical dietitian here in New York City. And we have a great show lined up for you. First half hour, we're going to talk to Dr. Heedeok Han about polycystic kidney disease.
Let's talk about PKD, and can you define it, and let's start there.
Yeah, so polycystic kidney disease, although it's actually one of the most common genetic conditions that lead to kidney failure, it's not like we see everybody, around us having that condition. So, and a lot of times patients, even when they live with it, are symptomatic until later stages in their life. It actually affects around 1 to 400 to 1 to 1,000 live births. And in America, it's about 600,000 people that are affected by it. About 70% of the patients with ADPKD progress to end-stage kidney disease, which is progression of chronic kidney disease to the point where you need transplant or dialysis by age 70. It's actually the fourth leading cause of end-stage kidney disease in America.
Go ahead. Yeah.
Yeah, it is actually, whenever you hear the word polycystic kidney disease, I think you can sometimes imagine what it is, but, kidneys having cysts, but it's sometimes a lot more than that. Kidneys, when they're born with it, when patients are born, instead of this cyst just growing out of nowhere, many patients are actually born with a lot of the cysts that that ends up growing throughout their lives and impacting kidney function. And although the name states as polycystic kidney disease, the proteins that is affected by the gene mutation is actually not just in the kidneys, but also in the rest of the bodies. So patients with polycystic kidney disease actually have a lot of other non-kidney manifestations such as liver cysts, spleen cysts, and one of the most dire complications is intracranial aneurysm, meaning there's like a small outpouching in the brain that sometimes end up growing and rupturing, and that can be a devastating complication of polycystic kidney disease.
If you'd like to join our conversation on nephrology, specifically polycystic kidney disease, but we have the expert, Dr. Heedeok Han, and we can really answer any kidney issue question that you might have. Our number here at Dr. Radio, 877-NYU-DOCS, 877-698-3627. First, we will go to to Bob in New Jersey. Good morning, Bob. Welcome to the show.
Good morning.
What is your question?
I have a cousin. She married a man who has polycystic kidney disease, and I had just started to do a little research. Is there a way for the disease not to be passed down to other generations, or how can that be, managed?
Yeah, that's a great question, and there's definitely a way to do so, right? It's through something called a PGTM. It's doing a pre-implantation genetic testing where they actually test the embryo for patients or families who wish to undergo in vitro fertilization, and to see which embryo is not affected by the gene that has been identified by the parent generation. And through that process, which is it's a very important thing to understand, and that's what was one of the reasons why it is very important to do genetic testing for a lot of the patients with polycystic kidney disease, is because once you identify the gene mutation that is affecting the parent generation, and we're able to plan the in vitro fertilization to ensure that this condition does not get passed down to the next generation. I do want to take one quick turn because I want to focus on something that Bob mentioned and I was thinking about again. And I think, not being, at the end of so when patients come to my office for polycystic kidney disease, I give a 30-minute presentation on what PKD is, because that's something, patient education is something that is so dear to my heart. But at the end, it's really what Bob asked. What about my children? What can I do to prevent this from being passed on? And, I want to mention Obviously, PGTM is very important, but there is sometimes doing the in vitro fertilization, and that process may seem very daunting. It's very costly. So there is a partner that I work very closely with. They're called PKD-Free Alliance, and they have a beautiful story. If you guys thought that my story was good, the founder for PKD-Free Alliance, his wife actually had polycystic kidney disease, and he donated his kidneys to his wife. And then, she was actually a patient of ours, and then, and she ended up passing away. And after that, he founded this organization where he actually supports patients and families who wish to end polycystic kidney disease in their generation and not pass it on. And they've had, they're partnered with, amongst not just us, but other great partners such as U.S. Fertility, other academic centers, and they have many, many success stories. They've so far welcomed around 14 PKD-free babies, one of which is actually a patient of mine, and she's very thankful for it. So I think there are really a lot, not in addition to all the other clinical trials and all the other research going on, there are opportunities like this that I think our patients really benefit from.
Thanks so much. That was so fast. I can't believe it.
Yeah.
Like, it's already, we kept you past time. Thank you so much for joining us. Dr. Heedeok Han again, he is Associate Director of the PKD Center at Columbia University Irving Medical Center and co-director of PEAK, which is a prevention education for patients with advanced kidney disease. Thank you so much for joining us. Stay tuned, you guys.